I'm calcium, and my family is the calcium family. We're a mineral needed by humans. Well, we're number 20 in the periodic table, but also the fifth most abundant element in Earth's crust. My great grandpa is Humphrey Davy, which was a British chemist that found the first generation of us, calcium. With the help from his friends, of course, which were a Swedish chemist named John Jacob Berzelius and a Swedish court physician named MMF Pantin. And I'm going to make a vlog for today, since it's my first day of school. Calcium darling, would you like a 450 milligrams of plain low-fat yogurt? Or 349 milligrams of calcium fortified orange juice? Or 333 milligrams of skim mozzarella? Or 325 milligrams of sardine with bones canned in oil? Or 307 milligrams of non-fat milk? Why should it be from your list? Well, you can eat other, but these are the top sources that helps you do your job. Okay, Mom, I'll be hurried since it's my first day of school. Just pack anything. Oops, forgot to mention, I have 4 little sisters that are basically the different forms of me. The first one is calcium carbonate. She has 40% elemental of me. And the second one is calcium citrate. She has 21% of my elemental. The third one is calcium gluconate. She is 9% of my elemental. And the last one is calcium lactate. She is 13% elemental of me.
Welcome to the first day of the semester. Since we are all new here, so let's start with the introduction from the front row. Please tell us your name, job, and the values related to humans' needs.
Hi, I'm Calcium, and my job in humans' body is to help build strong bones and teeth, place roles and muscles, nerves and blood, help lower high blood pressure, and prevent colon cancer. And I also reduce risk of kidney stones and obesity. The RDA that they need me is 1,000 milligrams for adults in 19 to 50 years old and males in 51 to 70 years old. Also 1,200 milligrams for female in 51 to 70 years old and all adults above 71 years old. The UL value for adults in 19 to 50 years old is 2,500 milligrams and for adults above 51 is 2,000 milligrams. Thank you.
Hi, I'm Magnesium and my little brother is Vitamin D. Our family works together in some of your family supplements. Perhaps, do you know my family?
Yes, we work together a lot. Some of my family supplements contain vitamin D and magnesium. Do you also know iron and zinc? My calcium family affects the absorption of iron, zinc, and magnesium. That's why it's a good idea for humans to take my family supplements at a different time from their multivitamin or an iron-rich meal.
Wait, I also heard from a friend who's in my drug class, and she said that you decrease the absorption of bisphosphonates, levothyroxine, phenytoin, telludronate disodium, and some classes of antibiotics like fluoroquinolone and tetracycline in humans' body.
Yes, I've heard of it from my family, and that's why we can be taken together. Also, my little sister, calcium carbonate, and vitamin D supplements can interact with thiazide-type diuretics, which increase risk of hypercalcemia and hypercalciuria.
Wow, my little brother and your sister need to be very careful. It can be very dangerous. By the way, I also heard that aluminum and I contain antacids that can increase urinary calcium excretion. On the other hand, mineral oil and stimulant laxatives decrease calcium absorption.
Yeah, that just happened. Even glucocorticoids such as prednisone can cause a calcium depletion.
Is that how the RDA can be met in one day? Wow, you're a very important mineral.
I guess so, because if they have a deficiency of me in their body, which mostly happen because of poor calcium intake over a long period of time, medications that may decrease calcium absorption, dietary intolerance to foods rich in calcium, and hormonal changes or genetic factors, a lot of things might happen.
Oh my god, what will happen?
So, calcium will be pulled from the bone for the sake of maintaining a constant level in the blood. When the blood calcium levels fall below normal, it is called hypocalcemia. Also, chronic deficiency of calcium may not show any symptoms, but lead to less dense, weakened, and brittle bones, which increase risk for osteoporosis, osteomalacia, rickets in children, and bone fractures. And another thing might happen is acute calcium deficiencies, which can cause memory loss, muscle spasms, and numbness or tingling in your feet and hands.
That's so scary. What are the effects of calcium toxicity in a human's body?
They will have excessively high levels of calcium in the blood, which is known as hypercalcemia, that can cause renal insufficiency, vascular and soft tissue calcification, hypercalciuria, and kidney stones. They can also have hyperparathyroidism or malignancy, which leads to the loss of bone tissue. Another one caused by my little sister, calcium carbonate, which is constipation. She is the most constipating, so people need to find another type of calcium supplement that they can tolerate the best.
Well, you really need to do your job well to help humans to stay healthy. What might be the common reasons for those toxicity?
Some people might have a health condition that causes excess calcium in the bloodstream, which causes hypercalcemia. People also might don't realize that they have a high calcium intake from dairy products, and people might try to stay healthy by taking calcium supplements, but they don't realize when they're exceeding the UL value.
Yeah, that makes sense since a lot of food and beverages contain lots of U.
Break time is over, let's go to the class. And that was my first day of school.